I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
Okay, and we're going to start the meeting today with a presentation by Animal Control Officer Nick Vidmar on coyotes. And I'll turn it over to you, Nick.
Thank you. My name is Nick Vidmar. I'm the Animal Control Officer for the town of Westport. Tonight I'm going to talk to you about the eastern coyote. I've been receiving a lot of calls about coyotes out during the day and what to do, so I thought I would present what you should do and just basic things about them. So today I'm going to talk to you about background and identification of them, their diet, their habitat, their mating season, conflicts with people, rabies, deterring coyotes, hazing, keeping your pets safe, the role of myself, animal control, and what residents can do about them. Background and identification, they're found in all U.S. states except Hawaii. I haven't made them their way yet there. They've been adapting with people for more than 100 years. They're known as also the prairie wolf or the brush wolf. Identification of them, they're roughly 25 to 35 pounds. Eastern coyote stands about 23 to 26 inches tall. They have a 12 to 15 inch bushy tail. They vary from gray-brown to yellow-gray. They have a 2 to 3 inch black tip at the end of their tail, so that's a really strong identification of them. Their eyes are yellow/amber sometimes. Their prints are identical to the dogs, however, their prints are more of a straight line rather than a domestic dog's. They howl and have other vocalizations such as howls, barks, whines, and yips. So as you can see on top, you have your eastern coyote, and then this is that's a German Shepherd dog. So a lot of people say, you know, there's a deceased German Shepherd on the side of the road. I'm like, okay, I'll go out, and comes to find out it's actually an eastern coyote. So sometimes people mess it up, but it's okay, I'll go out anyway. All right, so let's talk about their diet. Diet consists of small mammals such as your mice, rats, voles, rabbits. Out west, prairie dogs are a good thing for them. Here, woodchucks. They are also good berry and fruit eaters, sometimes roadkill. They've been seen picking up roadkill right as they're killed out on the roadway, and they're scavengers in that way as well. In urban areas, they're known to eat dog and cat food. So if you go to work during the day and you leave your dog outside with food and water, chances are the coyote will come and eat out of the food bowl and drink out of the water bowl. Food from your garbage can, if you leave your garbage open, they'll come out and literally go in and eat it and jump out and take off. Unfortunately, the possibility of small dogs and cats are a food source for them. There have been several cases where small dogs and cats have been taken by coyotes, unfortunately. They're efficient. They're extremely efficient hunters. They use all their senses to figure out where their prey is. A big reminder is coyotes do not hunt in packs, only wolves do. So when you hear a lot of them howl at night, they're signaling to each other that, you know, something is going on, but they're not actually hunting in packs. It's only wolves. Habitat. They like open spaces, rural forests, fields, thickets, marshes, woodlands, as well as populated suburbs around here, of course. They're mostly diurnal. They're most active dawn and dusk, so seeing them early in the morning is okay, seeing them at dusk is okay, seeing them during the day is okay. You just gotta watch their behavior. So those photos, there's a great example. You know, there's a car right there. This coyote is out during the day, just going around. This guy's in a suburb area, and then of course, they're definitely around homes. Mating season. So they mate once a year. Their mating season time frame is January through March. The males especially become more aggressive. You'll likely see more activity from them. They're also more vocal because they're communicating to one another. They have a home range of 2 to 5 square miles, so males will typically stay in that area. They give birth to pups in April or May. That's when they find dens and figure out a place to live, and that's where they start their family pretty much. Once pups are born, dens are made in steep banks under your shed, under your screen and porch. So once that happens, that's when hazing comes in, but we'll talk about that later in the presentation. Conflicts with people. Yes, there's a lot of conflicts with people, but not so much in Massachusetts. Conflicts do or don't usually happen. Very rare. They see humans as threats. I'll tell you about that more as we go. Sick coyotes, so they're not acting right, may go after kids or your pets. Human attacks can be provoked or unprovoked. During mating season, that could possibly happen. There are also common nuisances, getting into your garbage cans, not leaving your property, following you on walks. They can also kill livestock too, so when calves are born and baby goats and sheep are born, they can get killed by coyotes because they're so small and they're pretty defenseless in that matter. You should never ever run away from a coyote. I actually had one follow me several months ago. That was a pretty unique experience. It followed me all the way down a street. It crossed the street, followed me down another street, and then I went in my house and it went down the road. So it was definitely making its way down. But I wasn't running. I was, walking away of it, trying to see what it was doing, and if I had to haze it, I would haze it. Let's talk about rabies. Coyotes are rabies-carrying animals. Once a vector species such as a coyote gets rabies, it's pretty much done for. They get very agitated, angry, they start to freak out, they get very aggressive. Rabies is transferred through saliva, so the only way it can transfer to you is if it bites you or if it licks an open wound on your hand. Rabies is not treatable, it is fatal, so once it has those symptoms, chances are it's just going to decline after that. They can go after your large dog if they feel a threat from them. If your pet comes into contact with a coyote, they must be quarantined because of the rabies protocol in the state and other places. We had a dog last year get attacked by a coyote 5 feet away from its home, right outside the front door. So that dog had to be quarantined for 45 days. It attacked the dog, then left, and then I had to go out and quarantine the dog. And of course, contact your local animal control if you see one acting aggressive than normal or acting sick. There was one on Route 88 a couple months ago that kept going in and out of traffic. I went out, I evaluated it. It was just disoriented. It wasn't actually sick, so I chased it out, and police had to come and shoo it with me. So you never know with them. But he wasn't rabid, he was just disoriented, but that behavior may constitute a rabies thing, but it wasn't. All right, deterring coyotes. Big thing is hazing. Hazing is an activity or series of activities conducted in an attempt to change the behavior of a habituated intruder. So we want to reverse what they're acting like. So the goals is to reverse the habitation, discourage coyotes from the area. So the more you do it, the less they'll say, hey, I'm not going in that area anymore. You want to discourage coyotes from people, and of course, you want to increase awareness about coyote behavior. So the more we deter them from us, the more they'll be likely not to be in contact with us and interact with us. As you can see, the scars here. He's on the roadway. He's not doing anything. This guy could start hazing him, trying to get him off the roadway. So basic hazing, making loud noises while facing the coyote. You don't want to be turning away from it. You want to face it head on. Yelling at the coyote, waving your hands while approaching it. I tell people to get a metal lid and a stick and start whacking it as hard as they can and run at it. It gets their attention and they start moving. Like I just said, making loud noises with objects, whistles, air horns, megaphones, soda cans filled with rocks. Throwing things in the direction at the coyote. You don't want to hit them, you just want to toss it in their direction. So rocks, sticks, cans, rubber balls, tennis balls, anything to get their attention to make them move out of that area is a good idea. Water from a hose or water gun, I tell people to do that, or if they're going in and out of your yard a lot, automatic sprinklers are a good idea, because when the sprinkler senses motion, they're going to come and get sprayed by the water, and the more it happens, the more they'll say, hey, I want to get wet from here. And it will also spook them too, so the more times they get spooked, the more they're going to skedaddle. Lethal control should only be an absolute necessary thing. Contact your local animal control or police if you encounter an aggressive coyote. So if nothing's working and he's still coming at you, that's when you need to call animal control, because something may be wrong with that animal. You should also continue to haze. Don't just do it once and be done. Continue with that hazing to get that coyote out of the area. And the more you do that, the more they're going to say, hey, I shouldn't go around that area, because that guy comes out and slams pots and pans together, and I don't really like that. So that's what I tell people. They don't want to see Joe Schmo coming out with pots and pans all the time. I don't like him. He makes a lot of noise. Let's see here. Keeping your pets safe. A lot of people ask me, what can I do to keep my pet safe? Always walk your dogs on leash. If you walk your dogs off leash, chances are of them running away and then getting into a contact with coyote is always a possibility. Don't leave your pets outside unattended, especially during mating season. A lot of people just let their dogs out, and then something will come into the yard, they'll get into a tussle and leave. That's what happened with that dog I told you guys about. They let the dog out. Coyote came up, they got into a tussle. The coyote took a chunk out of the ear and left. And by the time she got out, the coyote was already making his way into the woods. Don't feed your pets outside. They're attracted to the food source. So if you feed your pets outside, make sure you remove the dishes as soon as you're done. Keep your cats inside to avoid being eaten during mating season. Yes, like I said before, they do eat cats, they do eat small dogs, but that's very rare. That's only if they're desperate, but it can happen. A lot of people ask me about fences. Can I keep them out if I have a 6-foot fence? The answer to that is no. They can jump 6-foot fences. So what do I do as animal control to help the public out? I try to educate the public. I tell them what to do, hazing. I tell them, if the animal comes back, let me know. I'll go out and assess the animal. By the time I get there, sometimes he's gone. So that's good. Education, of course. Tell them, what's going on. If the animal comes back, just watch him. If he has a good, healthy coat, if he goes from one side of your yard to the other, he's not sick. He's just finding his way to another location. I issue quarantines to animal involved with coyote encounters. So like that dog from last year, I had to go out, quarantine that dog for 45 days in the home, and then go back and release it. So that's what I deal with. If the coyote is there when I get there, it will be humanely euthanized and then tested for rabies that way. And it gets sent out to the state, and then it will get either a positive or a negative test, and that's how it's played out. I also monitor coyote behavior, so if there's like a den or an area where a coyote frequents, I'll go out and I'll monitor that location to see if he's still there, and that's pretty much all I do for that. So these are pictures, of course, of coyotes involved with animal control. You can see a catch pole with this. This guy looks kind of sickly. This guy's trying to bite the pole. He doesn't look too good. And then this one's just there, just hanging out. So what can residents do about coyotes? Of course, don't leave your pets unattended, even in fenced-in yards. Like I said, they can jump over and grab your dogs. Don't leave food or water out. Again, they're scavengers sometimes, so they'll jump over, see if they can get some food, because it's a free meal. Don't feed them. Don't feed wildlife, of course. Cover your garbage can lid. I tell people if your lid is open, put a rock on it or get a bungee cord to tie it up so it doesn't, because sometimes wind will blow it open and leave it open, and then animals can get in, and then they sometimes bring their trash out, and then it's a free-for-all for any animal, actually. Rake bird seed feeders. So earlier in the presentation, I talked about seeds, I believe. They'll eat anything they can get their paws on. Cover openings under your house and shed. That's a good way for them to make nests, or not nests, dens under your decks. And that's not a good idea to have a family of coyotes living under your shed or your deck. Keep dogs on a leash at all times, especially during mating season. Also, never, ever, 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 ever corner a coyote. It's bad. They'll want to attack you. They don't like being cornered, and they'll lash out. And of course, trapping does not work. Not only does it not work, it's also illegal. So if there's a coyote not leaving your property, we can certainly go out. But if it's a constant nuisance, we just refer them to a wildlife removal company. And I think that's it. Yes, that's it. And if there's any questions, I can answer any questions.
Great, thank you very much, Nick.
Yes.
Can you just remind us when mating season is again?
January through March. Let's go all the way down here. January through March, once a year. So, and then in April or May, they'll give birth.
Oh, good. Thank you.
All right.
Great.
Thanks.
Thank you very much, Nick. Appreciate
Thank
it. Okay, moving on. We're turning over to the Director of Public Health written report. Any questions? Otherwise, we'll go right into your verbal report.
All right. So, let everybody know that we had some COVID tests come in. We have them at the Board of Health office and the nurse's office. So anybody needs any, please come up to those offices to get your free COVID test kits. Mosquito and ticks, they're out and about in force this year. It seems we have quite a big problem this year around the area. Both mosquitoes and ticks can carry diseases which can make you very sick. About 3,000 different species of mosquitoes have been identified worldwide, 51 of which have been found in Massachusetts. Most mosquito bites only cause itching or skin irritation, but some species in Massachusetts can carry West Nile virus and Eastern equine encephalitis. Mosquito-borne illnesses can be very severe, so taking steps to avoid mosquito bites is very important. You can protect yourself by reducing mosquito breeding in your home and using mosquito repellent. The U.S. Environmental Protection Agency has a helpful tool to help you find a repellent that is right for you, and that's you can find that at www.epa.gov/insect-repellent-wipe-u. There has been a total of 145 positive mosquito samples so far this year detected from Barnstable, Berkshire, Bristol, Dukes, Essex, Hampden, Middlesex, Norfolk, Plymouth, Suffolk, and Worcester counties. The risk of human infection with West Nile virus is moderate in the greater Boston area and in parts of Barnstable, Bristol, Essex, Hampden, Plymouth, and Worcester counties. Ticks are tiny bugs mostly found in shady, damp, brushy, wooded, or grassy areas. Infected ticks are found throughout Massachusetts and New England, not just Cape Cod. Ticks do not fly or jump. They attach to animals or people that come into direct contact with them. Deer ticks and dog ticks are found throughout Massachusetts. The most common tick-borne diseases in Massachusetts are Lyme disease, babsiosis, and anaplasmosis. Other diseases that are more rare but still occur are tularemia, Rocky Mountain spotted fever, Borrelia, forgive me on this one, Myamotai, and Powassan virus. Tick-borne illnesses can be very severe, so taking steps to avoid tick bites is important. One of the most important things you can do to protect yourself is check yourself for ticks once a day after being outside. Using tick repellent is another important prevention measure, and again, you can find what the right repellent is for you at the same link as I read off earlier. Blood drives have been scheduled for the summer. They will be held at White's of Westport from 2 p.m. to 7 p.m. and we have one scheduled on August 29th, another one on September 19th. August 31st is International Overdose Awareness Day. For nearby events, please visit www.overdoseday.com/USA/Massachusetts/. Lot 3 at the transfer station has been prepped and ready for the scouts and bike recycling to move in. The scouts are in the process of moving in and hope to be fully moved in this coming weekend, the weekend of the 24th and 25th. On August 12th, the bike recycling officially moved their operation down to Lot 3. So in the coming weeks, I'll extend an invitation to Representative Paul Schmid, Mike Rodricks, and the town administrator, select board, to come down and view the site if they so choose. Board of Health, of course, welcome to come visit the site. And yeah, it's a nice area, and I think it's going to be good for those entities to do their redemption, have the redemption areas and recycling area. I just also wanted to mention that there was a triple E positive mosquito found in Westport. Specifically, it was found in the southeast region of the town. The sample was taken on August 12th, but our risk level remains at moderate for Westport at the moment. So.
And I just want to mention, I just got notice from Olive that the town received a bike recycling micro grant for $5,000, so that will help them with site improvements there in the bike recycling area, so that's great.
Let's move on to director approved plans. So I have a this is a repair on a dry storage facility on 1180 American Legion Highway, lot size 203,816 square feet for McCady LLC. We have a 3-bedroom repair on 772 Gifford Road for Joel Sunderland on a 78,408 square foot lot, 3 bedrooms. This one is replacing a cesspool. And we have a 3-bedroom new construction on 21 Courtney Drive for a Cherry Rock LLC. This one's utilizing a quick 4 and a Singular 960 DN. And that's it for director approved plans.
Okay. Any questions on those?
Nope.
If not,
I move that we endorse the director approved plans as written.
Second.
all in favor? Aye, that's unanimous, thank you. Okay. We have a couple minutes before, our first
We have
appointment's at
minutes.
4:40, so we have some time to keep on going. Okay, next we'll review minutes. July 22nd, this is a regular meeting. Any questions, concerns about that one?
None, we're gonna do them individually since there were two that
Yeah,
one was
let's do them
Phil wasn't
individually.
at and then I wasn't at.
Okay, so.
All right, so I move that we approve the minutes for July 22nd, 2024.
Second.
All in favor?
Aye.
That's unanimous, thank you. The next one was July 24th. This is a working meeting.
Actually, that one was, Phil wasn't there for that one.
Okay, well, I will second that motion, and it'll be you and I, and
Okay.
you'll abstain because you
Okay.
weren't there. Okay, sorry about that. July 24th, we were all there. So this was a working meeting, as I said, talking about a couple of proposed regulations.
So I move that we endorse the plan, excuse me, I move that we approve the July 24th, 2024 minutes.
Second.
All in favor?
Aye.
Aye, that's unanimous, thank you. Okay, next is August 5th. This is a regular meeting.
And that's the one I was not at.
Okay.
So
You had some,
so this is on the August 5th meeting on the second page, the top, the last paragraph on the discussion of the South Coast Public Health Collaborative, where I gave appreciation to the chair, and it was to Ms. Kirschke, anyway, to Olive, because of their active roles in developing programs, and not Ms. Amaral, although she does an exceeding amount of work for the board as well.
so that's one correction, and then on page 3 or 4, the line, second line, Bob, that developing, Phil was talking about potential changes in well regulations and developing possible draft regulation for wells, not for tight tanks. So,
So I'll move to approve the minutes of August 4th with those minor corrections.
second, all in favor?
Aye.
Aye.
With
and
one
Donna
abstention.
abstains. Okay, thank you. Last one is a special meeting of August 9th. We took care of a bunch of business on that day. Any questions or concerns on that one?
I don't have any, so I move that we approve the minutes for August 9th, 2024.
Second.
All in favor?
Aye.
That's unanimous, thank you. Okay, we can move on to other business. First up was 29 Cornell Road, system repair issue with a failed cesspool. We have an email from a Mr. DiNardo, and I don't know if he's coming to
No,
plead his case.
I don't see him.
Can you give us the background on this one?
So we had a box of plans that has been building over the years of people submitted plans, but nothing ever was done on them. A lot of them were for failed systems. So we were finally able to find some time and get through that box and send out some letters to these people. And this was one of them, asking, what is your intention here? You got a failed system. You have a plan that was submitted and approved in this case, 2021. Are you going to replace the system? What's the timeline here? So Mr. Donato came in, cited a bunch of reasons why it didn't get done, and said he'll have it done in the first quarter of next year. So I said that I'd have to bring this by the board, they would have to make the decision on that, and it's about all the background I have on this so far.
Okay. So this was a failed cesspool, correct?
Yes.
And I had in the notes from the database, it was been since 2020, but you were saying 2021.
Well, I looked at the stamp on the plan here,
Okay,
and it was stamped 1/29/21 as approved.
okay, so,
But it could have, so it's from date of known failure, and it could have very well failed per the Title V, the year
so
before.
it's been in failure for 4 years. He has 4 properties in town, he's got plenty of land in town. Obviously, he's got a lot on his plate, but I'm concerned that this has been 4 years already. I would say that if he wants an extension, he needs to come and plead his case, because this email is light on details. But I'm open to what other board members would like to do.
I agree with that.
I don't feel strongly about it one way or the other, actually, so I don't know if what Matt heard was, convincing in any way, forgetting it's more, I think it's somewhat less the previous 4 years as why he needs, another 9 months, maybe, or not quite, in order to do it. Was there any reasons why he couldn't start earlier, I guess?
I would just say
The
that.
first quarter takes him through March, really.
Right. He just cited there was some personal issues.
hardship.
Yeah.
Yeah, so.
I
So,
think we need at least a stronger commitment than this, sort of vague, planned for next year. Seems a little too vague to me, given that it's already been 4 years, so,
yeah. Well, and in other situations, you could, kind of basically get an agreement that, okay, we'll extend it, but, then if you don't meet whatever timeline we come to agreement on, then there'll be an agreement to assessment of fines.
yeah.
So we could do that too. It's easier, so that he understands and that he agrees, so maybe that's an advantage of coming forward and saying, our patience has run out, so therefore we need to do this, or there needs to be an economic consequence.
Okay.
So that's one possible outcome that we could use. I don't want to put the gentleman on the spot of revealing things he doesn't want to reveal. That would be public.
Right.
But I just think we have to maybe communicate that we're serious about it.
So, you're suggesting that we send a letter saying, we give them a specific time frame in which it must be done, or fines will start occurring?
Right,
Or do you want
and, right.
to say he needs to come into the next meeting?
Yeah, I mean, we could do either of those things, I think.
Okay, well,
And so, so I think we, so I think what we're saying is that he has to complete, and maybe that also means kind of get a certificate of compliance for the upgrade of the facility, on or before March 1st, 2025, or we will commence, assessing fines consistent, with our regulations. So I'm making that as a motion if that's what we want to do.
okay.
Well, question. If you're gonna make a motion about the specific language of the agreement, then I would also suggest that we add into that agreement that the system be pumped, I don't know, weekly or monthly, or I have to look at see how many bedrooms exactly there are. I think it's 3. But, so the system doesn't go
Monthly?
any further threat to public health.
Yeah, well, I think I guess we were leading to just issuing it. I don't mind the agreement part, but an agreement requires exchange, that he would give us something in writing. Whereas if we did it this way, we could just say we're issuing an order, and this is, I guess, if that's. and
Yeah,
this is
just
what the
issue an order with these conditions.
This is what the order is,
Yeah.
and conditions, and that
Yeah.
Okay, so,
so we could,
so agreement, so we're issuing an
By
order
the-
that says it must be completed with a certificate of compliance by March 1st, 2025. And in the
pump the
interim,
system by the end of September.
huh?
How soon do you want to, or how often do you want to?
I would say the system needs to be pumped immediately, because I don't know when the last time it was
Okay.
pumped. I'll have to take a
Pumped
look at that.
immediately.
If I look and I find it was
You
pumped,
You should give them right, by the end of the month?
yeah, by the end of the month,
In
okay.
August, and thereafter monthly until,
Yeah, that's all.
until,
Then monthly, okay.
okay.
Okay, I second it.
So motion made and seconded to issue an order to Mr. DiNardo to complete his repair by March 1st and with a regular pumping schedule, otherwise fines will be assessed. All in favor?
Aye.
Thank you. Yes, me too. Okay, that's unanimous. Okay, that's first. We have highway it's 4:40, so I'm going to postpone the other business, and we'll take that up after the appointments in between. So I will call for the 4:40 p.m. Local upgrade approval hearing for Mark Rodrigues representing Paul Cadu at 69A Hillcrest Acres with a 3-bedroom repair with a bottomless sand filter and Advantex on a 10,309 square foot lot. Mr. Rodrigues, yours is the floor.
Good afternoon, folks. Nice to see you. Mark Roberts, Analysis and Design Engineering. I'm here regarding a septic repair plan upgrade at 69A Hillcrest Acres for Paul Cadja. What we've got here is, as we've mentioned, it's a 10,300 square foot lot. It's a small lot. It's got an existing structure on it, 3 bedrooms. The intent is to raise and reconstruct that somewhat dilapidated 3-bedroom, which would have a slightly smaller footprint, maintain the 3-bedroom design. We had 2 wells that we had numerous wells, but we had 2 wells that were within 100 feet of any proposed area for the leaching system. I proposed a bottomless sand filter here, as I've done several of lately, here in Westport, that's got a minimum footprint for a compliant BSF design in accordance with the regulations. The only waivers that we're looking for, other than we did do a sieve test for sizing up the BSF as we should, is we've got 2 wells, the well serving this facility over here to the south, and also the abutter well to the west. I've arranged to place the bottomless sand filter 10 feet off property line, equidistance from both of those wells at approximately 64 feet to get us a setback of 64 versus 100. And that's what I'm here with the requested waiver. There's really not a better spot to put it in considering all the wells. So this is what we've got. It's a nitrogen reduction system, of course. In terms of well water testing, I did submit with the package the baseline well water test for the lot. And I do know that the applicant and the abutter, I do have the abutter green map.
Thank you.
Records. There's a scheduling is underway right now to get that baseline well water test taken care of as well. It'll probably be Envirotech that does that water sampling as they did for the site well here.
Okay, all set?
Yes.
Thank you. We'll turn it to Matt. Any comments?
No, best you can do on this very small lot, so I didn't see nothing that could be done differently.
Okay. Questions or comments from the board?
I'm really reluctant to make this comment, but maybe you will educate me about it, which is the situation of how we treat. Is this an issue around new construction based on the fact that the house is now being demolished?
It's being demolished intentionally and rebuilt, so yeah, I think it qualifies as new construction under our reg.
Okay, so then we wouldn't be treating the setbacks, maybe he isn't, as local upgrade approvals, right? You'd have to be getting a variance.
Well,
So that's why I'm reluctant to raise it, because the outcome, I think, will be the same.
yeah.
But just to, because I thought maybe I was reading something into regulations as to how we've interpreted them in other circumstances, which we, and the regulations are oblique about this,
Very.
because it says that the building has been demolished, which suggests historically there used to be a property on the site, a building on the site, but there is no property there where the building is.
I can comment, Phil, if you.
Good, yeah, I don't want to be overly bureaucratic about it, but I
This
just,
topic has come up before. In fact, you raised the question before.
Yeah.
And
I don't want to raise the question, but because we put people through some some, loops or hoops about it.
Answer too, so go ahead.
Go ahead.
You try first.
If you will,
Yes,
per your town's regulation, the fact that we're raising and reconstructing a structure puts us in a new construction requirement. So that says we shall have denitrification for the system. However, Title V,
oh, that's right,
I think we did go through this.
that's right, okay, that's
And it was a
right,
good-
that's the
it
answer.
was a-
Mhm.
Right, but
Because your
Title
flood
V
zones
says
are
you're
covered by Title
replacing an
V.
existing system with no increase in design flow. Therefore, it should be addressed per Title V regulation as a repair.
Yep.
So what we've done here is we sort of went down the middle.
Right,
Yes, we will and shall have denitrification,
right,
but we can address the compliance with code and regulation as a repair.
Right,
And
exactly.
that's what we did, and that topic came up, which is why I knew I
Good.
recalled.
Okay,
how-
that's
how
good.
I should and we should be
good,
addressing
good
this.
refreshing my recollection. And as I'm looking at my notes, I realized I wrote new construction and then crossed through it, and I couldn't remember why I did that, so that's helpful. Thank you.
This will, under our local regulation, require the 2 times per year total nitrogen testing. That would not necessarily be required under the DEP approval.
Yes,
Oh, yes, it would be because it's such a small lot anyways.
if it was considered a nitrogen sensitive area,
It is.
by your regulation, yes.
But by DEP as well. Because if it's when it's an on-site well and septic. 'Cause we were just looking at this earlier today for something else.
Mm.
So,
That is correct.
any area where the use of both on-site and wells that are not regulated is, yeah.
You are correct. It does say that, and I dealt with that in the town of Swansea. But there was no structure, no existing system. And compliance with that regulation that you were just referring to says, think more like 10 parts per million, not 19.
I know,
So it- it's
we're not going
very
there.
ugly, if you
Yeah,
will.
yeah, we're not going there.
Use that term loosely.
Okay, but just the total nitrogen testing will be one of the requirements.
As
Okay.
expected, yes.
Okay, any other questions?
No, I'm fine.
Okay. Somebody prepare to make a motion? This will require a deed restriction, obviously the well testing, and the other needs of stuff, right?
All right, so I will move to approve the plan for Paul T. Cadu at 69A Hillcrest Avenue, 3-bedroom repair on a plan dated 8/1/24, subject to a 3-bedroom deed restriction, a local upland approval for the site lot, for the well at 64 feet rather than 100 feet, and for 75 Hillcrest, the butter setback of the same 64 feet rather than 100 feet, approval of approval of the sieve analysis, 2 years of well testing, and a hold harmless agreement.
Do we need water analysis as well?
Well, that's the well testing.
The well
No,
testing.
because it's already D-nite, so we don't need to wait for that. And then 2 years total nitrogen
And
testing.
2 years of total nitrogen testing, yeah.
Okay.
And you did say the 3-bedroom deed restriction, correct?
Yeah, I did say that, 3-bedroom deed restriction.
All right, so I second that.
Motion made and seconded to approve the project at 69A Hillcrest Acres. All in favor? Aye. That's unanimous.
Thanks, Mark.
It is exactly 4:50 PM, so we are right on time. We're going to go next to a continuation for Sally Brayton, current owner, the future owners or pending owners, being represented by Bill Smith at Civil Engineering. This is a property on Macumber Lane, map 89, lot 113, 3-bedroom new construction with Caltech chambers and, I believe, Advantex now.
Advantex now, yes. Took your recommendation.
I,
better of the advanced treatment systems. The other adjustments we made relative to the septic system, we moved the well a little bit further to the east in order to maintain 100 feet to our retention basin. We raised the grade over the tanks because that was a concern with being in the flood zone. We wanted to provide as many tanks as we could, so we are at or above the base flood elevation for the grade over the tanks. We did relocate the construction entrance off of, I guess, River Road or Colchester Road per one of the neighbors' requests. Speaking of neighbors, this is an email from Mr. Katie, who didn't have the proper notification at
Right.
the last meeting. That's an email from him to Mr. Humphrey stating that he was in favor of the project that had no reservations.
okay, yep, great.
The other thing that we've done, we added the DEP references to the advanced treatment on the plan that you had requested, and we put together a fairly extensive stormwater analysis for the property. Basically, stormwater from the site, from the structure will go into a storm scepter for our TSS removal. When I spoke with the storm scepter folks, we get up to 99% TSS removal, which is well in excess of the 44 that's required. From the storm scepter, it will discharge to a bioretention basin. Water that's going to flow over the driveway will be pervious pavers, so that we get infiltration there. We meet the recharge, water quality, storage volume, TSS removal, all of the parameters that are set for the stormwater. Be happy to answer any questions. I haven't met, we briefly talked about it when I delivered it. I don't know if you had a chance to.
I did.
Any more in depth.
Excellent stormwater plan, well put together, has a good O&M plan, so I didn't have any issues with the stormwater plan.
Great, thank you very much. I think we've addressed certainly all my concerns. Any other questions?
I really appreciate your responsiveness.
Great, I appreciate that.
Sorry, there's someone who has a hand in it.
Yeah, sure.
We did not receive this certified letter from CEC.
Excuse me, could you come to the mic and
sorry.
state your name for the record? Thank you.
We are in a butter across River Road.
Okay.
My name is Charlene Connolly.
Okay.
The address is 832 River Road.
Okay.
So we did not receive the certified letter. It was at our address where we pay the taxes from for that piece of property. We have one well that is owned by two families, ourselves and the Siegel family, that is located in the rear of the Siegel's house. It's a dug well. If the dug well should go for any reason south or not good, we would then place the well in the rear of our property, which is close to the property that wants to be purchased. So my concern is that it might not be 100 feet from their well.
I'm gonna let the engineer speak to that, because they would only be addressing existing wells. They can't plan
I know,
for wells that don't exist.
Water is a very big issue in our area, as you are well aware.
Sure.
So what would be the ruling then if we had to be within 100 feet in order to get water for us if our dug well went forward?
I don't have your site plan, for your property in front of us, so it's hard for
right-
me to
it's right
evaluate, but I'm
there.
gonna
It's
ask.
listed on there, it shows where the well is, and I wonder,
So it's very far away. It's well more than 100 feet.
but, yes,
Is your
but-
property the Yellow House LLC?
no, we're the barn.
Okay, and again, what was your name, please?
Connell.
Charlene?
Yes. There, so the curve, where's the yellow house? Is this the yellow house?
No,
No.
I think it would be
Here's a-
over here.
Yes, I'm sorry, it's over here. So,
So you would be putting your well somewhere
very
over?
close to River Road, on this
Okay.
corner, right in here.
All right, so our septic system is up off of Macomber Lane, so the pollutant source for that, any impact to that would certainly not
But our
affect your well.
septic is right here, so it's a distance from that. So it sort of leaves us with no alternative but to drill a well here. Do you
And-
understand what I'm saying?
Sure, and I don't see any issue with you drilling a well.
Okay.
It-
I just
The
don't
well
know.
doesn't have to be 100 feet away from an adjacent well,
Okay,
and we want to make sure it's 100 feet away from the leaching field, which it is more of a pollutant source. But there's, looks like, from what you described, certainly plenty of room for you to drill a well that won't impact the proposed well, or would still allow you to have a source of water.
okay.
So it would, what he's saying is it would not, under Title V, your well being proposed would be more than 100 feet from the septic, the leaching field.
From the leaching, which is up here.
Right,
Okay.
yeah. So,
Yeah.
so that should not impact your well. That's what Title V requires, is the 100-foot setback. So from what he's describing, you would have enough room to put a new well in.
Because I
But-
obviously have to, being that it's two owners, we share a well.
Right, yeah, but that's,
Right. It happens, right?
we're thinking about developing well regulations to try and address some of these issues, but we don't have them yet.
Do you want me to provide a mic? I can ask another question.
Sure.
So, we knew very well Kendrick Snyder, which I'm sure that you probably knew. Kendrick's his daughter's right here.
He's our architect.
And, yeah, exactly. And so, Kendrick had told us that he had attempted to perk that property. We know at least 2 times. And I was wondering, in this process, it would appear to me that he would know not to put the septic close to River Road, so where it would be perked. And I just was wondering if anywhere in this process that you investigated in your back files, that this property was perked in the past.
So we, as part of the process for this evening, and the subsequent approval in 2017 that had expired, perk testing and soil evaluations were conducted on the property. There were 4 test holes dug up in that southwest corner of the property up towards Macomber Lane.
Are you saying that's what Kendrick did? Or
This was this was done for Sally.
You know what, I'm not talking about Sally Brayton, I'm talking about it was properly perked in the past, and so perhaps he would have been perking the same spots, I don't know. How does that work?
I honestly am not sure where that other testing was done. I do know that we had done testing in the spot that we've designed the septic system. That testing was witnessed by the Board of Health.
Oh, yes, I know,
Yeah.
absolutely,
Yeah.
I totally get that, yeah. Okay, I just wanted to mention the history on that property, which sometimes can be important.
Yeah.
Thank you.
It can be illuminating, yes. All right, thank you very much, Ms. Conlon. Any other questions or comments from the audience? Okay. And we're all set, board members, no further questions, anybody else? We've cleared the decks. Then I think we're ready for a motion. Sure.
So I will move to approve the plan for Sally Brayton at, I guess I had plat 89, lot 13 on Macomber Lane, new construction, a plan dated 5/6/24.
Was it revised 8/6/20?
8/6/24, I think that's what I
Yeah.
wrote, I put it in my handwriting, 8/6/24. subject to Concom approval, a 3-bedroom deed restriction, a grant of variance from the board to the Board of Health septic system location regulation, section 6B, a hold harmless agreement.
Okay, and then,
Oh, for the Adventics,
because this is a, you're using it for, nitrogen credit, it will meet the need to do the DEP 4 times per year testing, right? So it's in accordance with the approval letter. That's restricted than our requirements, so that would prevail. So we don't need to mention that.
So that's it, and.
And I second that.
You ready? Did you
I'm
finish
ready.
that? Okay,
Yeah.
so motion made and seconded to approve the project at Plat 89, Lot 113, known as Macomber Lane. All in favor? Aye. That's unanimous. Thank you very much. Thank you for your patience.
Thanks.
Thank you.
Thank you.
And we'll just keep this for this email for the file.
Thank you very much. Have a nice evening.
Thank you. You too.
Again, thank you and your clients for being so responsive.
Thanks, Bill.
Thank you.
Okay, I'm going to call the 5 p.m. hearing. I'm going to ask folks to move out into the hallway. This is for 1954 Main Road, John Clemmy, Len Potter representing. This is for a 4-bedroom repair with a quick infiltrator quick 4 system on a 14,534 square foot lot.
Good evening. Len Potter here for John Fleming, 1954 Main Road. We have a small lot, 14,534 square feet. I was able to successfully locate at the eastern side of the lot, downhill side, and located with wells surrounding. The only well I have an issue with is the old well, which is shown on the plan. And the new system will be 76 feet from the proposed use area. It'll be just a little bit further than the cesspool is now. The water test was done, and the nitrates are low. Everything was fine with the water test. It's a small lot, all I can do is the best I can do with what I got, and I've worked out except for the well variance. The water table was good, the perk rate was reasonably good. This is not a bad area for soils and water table building, so that's what I got.
Okay. Matt, you
No, I agree with Len, and this is an MFC. He submitted a maximum feasible compliance waiver. It should be in there for the board to review. So.
Okay. Questions or comments from the board?
Nope, I'm good.
I'm okay as well.
Okay. I would then entertain a motion.
I move that we approve the plans for 1954 Main Road owned by John Clemmy, dated 6/18/24, 4-bedroom repair, with the variance of the SAS to the well being 76 feet rather than 100. And the following conditions: hold harmless agreement, 4-bedroom deed restriction. Do we need the water testing as well?
Yes.
Yep. 3 years of water testing.
I'll second that motion.
Motion made and seconded to approve the project at 1954 Main Road with those conditions. All in favor?
Aye.
That's unanimous. Thank you. Thank you, Mr. Potter.
Short and sweet.
Thanks, Len.
Thanks.
Okay. Alrighty, so we are turning back to other topics, other business. We addressed the 25 29 Cornell Road one. Home burial policy, I had hoped to have the final policy for review and approval today. However, a wrinkle came up that I'm sort of chasing down with DEP with regard to home plot, private plots, so it doesn't become a cemetery issue per se. So there's a little nuances to try and clarify. I've also had further discussions with DPH around some of the pathogenic disease concerns, and the three that they raised concerns about are so rare and would be sort of intercepted by either CDC or DPH, and they would be given instructions on final disposition, probably cremation would be required. So I think it doesn't need to be in the policy because it's going to be addressed before it ever gets to that stage. So, and then all the other comments I've incorporated. So I think there's just this one outstanding issue that I'm waiting for clarification from DEP on. So I hope to bring it back at our next meeting on September 9th. Okay, the item number 3, part-time animal control officer. Matt and I attended the select board meeting, and I'm going to turn over to Matt for an update.
Sure. We attended the select board meeting at their last meeting, which was a week ago on Monday, with our proposal to hire a part-time animal control officer at 20 hours a week. We went in with, we wanted the position to be benefited because we believe, based on past experience, we couldn't attract anybody because people wanted benefits, they wanted sick, vacation. So we went in requesting that. The select board, however, for various reasons, didn't want the position, or didn't authorize the position to be benefited. So we're going to go in at 19 3/4 hours. I believe that was what the ruling was, to try to attract somebody at the $25 an hour rate, which is the exact same rate we went out at last time, but the difference is 4 3/4 hours. We went out last time at 15 hours. This time we're at 19 3/4. We'll see. I put the ad out, and we'll see if we get anybody.
We did get approval from the personnel board at the time, and they were saying to us, for want of, 50 cents, they would be happy to increase the rate if that's what it took to hire somebody, because the whole point was to fill the position. And they were agnostic ultimately on whether it should be benefited or not, that was up to the town administrator and the select board, and they ruled not in our favor on that. So as Matt said, we'll just try our best, and if not, and we may try to propose a higher rate to compensate for lack of benefits, because if we can't fill the position, there's no point in having the money in our budget. Then we either have to do something, we have to think of something else. So that's where we are.
Free access to the town nurse.
We have one animal control officer. We can do the best we can to cover the town, but it's not feasible to have 24/7 coverage with one animal control officer. So we'll cover as much as we can when we can, and just do the best we can.
And he is off for the next few weekends because of vacation and so on.
Yeah.
So there'll be no coverage for a while on weekends. So that's the update there. Okay, board member updates. Tom, I'll turn.
Sure. So I had a telephone meeting with Olive, the Shared Services Coordinator, about the opioid settlement funds and how we might want to proceed to approach the select board about the Board of Health's role in helping determine the best possible use for those funds. And I just wanted to read one part of the abatement terms. They have very detailed abatement terms, how this money should be utilized.
They being?
The state,
Attorney General.
the Attorney General's office,
General,
right?
okay.
So the Commonwealth and its municipalities have a shared commitment to use abatement funds recovered from the statewide opioid settlements to supplement and strengthen resources available to Massachusetts communities and families for substance use disorder prevention, harm reduction, treatment, and recovery in a manner that, and they have all these bullets, and I just put the first one out, reflects the input of our communities, of people who have personal experiences with the opioid crisis, of experts in treatment and prevention, and of staff and organizations that are carrying out the abatement work. That hasn't happened. And so what my proposal is, and I wanted to bring it before the board anyway, to discuss whether or not this is something that the board feels comfortable taking a leadership role in, because it would be myself and Olive who would be taking the bulk of the responsibility for facilitating discussions, facilitating recommendations. We don't have access to the funds. We don't have, the Board of Health does not have any say, as far as I'm aware of how these funds are dispersed. So part of what we want to do is take some leadership and what the Board of Health is willing to do to make sure that these funds are used appropriately, and also so we can continue to receive them, because there are some things that have to be done in order to continue to receive the funds, and that's not been done thus far as I know. Part of it was that they had to have a report ready to say how we've been spending the money. And to my knowledge, I don't know if that report was done. Could you just say something about the letter or the email that we received? Who did we receive an email from about the deadline for the report?
So from the state, it didn't come to me, it went to the town accountant and Linda. Basically, we got a second notice, because Linda had forwarded it to me, saying we still haven't received the report, and they went through the whole thing. And basically, the town's at risk for not getting any further funds from the opioid settlement if they do not start, the mandatory reporting requirements as outlined in that
Right.
in the program.
And I can forward the outline to both of you to take a look at. But I mean, it's pretty detailed about where they are supporting funding being used. But the first thing reflects the input of our communities, and there's been no input, right? So that's one of the things that I and Olive want to do, is at least do a focus group, contacting people we know that have been impacted by opioid addiction, and have them come in and say, what do you think, where do you think this money should be utilized? How would it be best utilized in the town to help people in the town? So anyway, so that's, Olive already has a five slide PowerPoint presentation to do to the select board, which basically outlines some of this, pieces of this, with the idea that we want it to be public knowledge, so that we want it to be presented to the select board so that anybody watching knows that this funding is available. We need to make decisions about this funding so we don't lose the funding, and say that we are willing to take some leadership around that. And it's around where that money is going. So, but I wanted to hear input from the two of you about what you think.
I think there's been some informal discussion with the select board or some members, trying to move this forward, and there hasn't been any action.
Right.
I don't know whether we should pursue that one more time, to kind of say, we're ready to help.
You mean in an informal way?
Yeah.
Rather than go before the select board?
Yeah, because it, figure out
Yeah.
strategically what would be the most productive way to,
Right. I did forward this, the statewide commitment to abatement, to the chair of the select board, and mentioned that there was a deadline, so we don't lose funding. So I don't know.
what's the deadline, do you know?
Is it this Friday, right?
I think so.
Is it this Friday or was it last Friday?
I think it might be this Friday. I'm not sure, because we're not involved, I don't know. I mean, I'm not in active communication with the town administrator or anybody about this because we're not involved. So I don't know if it's possible they've done something, but if they did, I wouldn't know.
So just to clarify, is the primary deliverable a report that lays out, a plan, or is it supposed to be a report that says this is what we have spent money on?
I think it's both.
Because we haven't spent any money as far as you know.
As far as I know,
Right.
but, because we don't have any access. But we
Yeah.
know that there's money in an account and it's over $100-something thousand.
There is the
The
AG's
dashboard.
office has a dashboard, and you can look it up, and when scheduled disbursements are for every town, because I looked at it, I want to say, I feel like a year ago, it was a long time ago, and it was already more than what we put in town meeting account, that account.
Which the town voted on to move into an account.
Right.
So, we
I
have
remember.
we has a designated account, and there's
Yeah,
money
yeah.
there, and it's not to be utilized for supplementing the budget. It's
Right.
to be looking at these particular issues and how we can, distribute the funds to benefit residents in Westport.
Well, who was the person at town meeting who advocated for the article that created the sinking fund for this? Because there was someone at town meeting who spoke on behalf of it, and I don't think it was someone from the treasurer's office, was it?
No, I think it was Val Bassett, no? I think so.
It may have been.
A town resident.
A town
Yeah, it's a
resident,
town
yeah.
resident, and I have information about her. When we did, so back in May, Olive and I put together a presentation on the impact of opioid addiction on individuals, families, and communities. It was at the high school. And there were a few people there that I suggested at the presentation that if anyone was interested in helping steer the funds use, that they could sign up. And so I have 2 names on that list, and they were people who I believe work in the field. But also there was one woman who spoke who's from Westport, who worked in the Westport school system, who lost her son to opioid addiction. Who would be a wonderful resource to talk about impacts on families and where that funding could go to help families. There are also a number of grandparents, and I don't think people appreciate this, that are taking care of their grandkids because of addiction, because the children's parents cannot take care of them because they're struggling with addiction. So, there are many places where, as part of in the Board of Health and looking at mental health issues, that we could have an influence or an impact to steer this money to places where people can truly benefit. And as it stands now, we don't have any.
Right, well,
It seems like we need to move this forward somehow.
Well, and I spoke informally to Jim, the town administrator, and talked about getting input from the community. And informally, I mentioned it to Shauna, the chair of the select board. I don't think I've spoken to anyone else about it, but I have, and I know that you have informally as well. So I don't know if we need to formalize it in order to get something going.
Well, I'm wondering if maybe we start with a letter with an offer of a presentation about what we can do, just a letter with, putting it on record, basically, formally, that, we're concerned that we want to help the town, utilize these funds in a way that's helpful for the impact to members of the community. And here's our proposal.
Rather than go before the select board.
Well, start there. Here's our proposal, and we'll be happy to present it, publicly, because the presentation part is also a way to get the word out there. But in terms of requesting to be on the agenda, I don't know when their next meeting is or when's an appropriate time. I don't know, what are your thoughts?
Well, yeah, I mean, I think that makes sense, and if we wanted to request, to be placed on the agenda to talk about it, I think the worrisome thing is that we don't know, or to understand what the risk is that, we would either lose funding or, and so there's a sense of urgency from that part of it. That's all. So, I mean, I'm sure you write a good letter about it. It's just kind of an odd situation where you kind of can't find out what's going on, having talked to these, the people who should know what's going on. So, but maybe doing the letter and asking to get, to be considered to be put on the agenda, makes sense.
Okay.
To me, it does.
I wonder
But it would be
if
good
there's,
to know in advance of the meeting,
Well,
once
maybe we can get
they
guidance.
decide to say
We
you'd be
can
on the
reach out to
agenda to get the
the Attorney
information.
General's office and find out, what are the timelines, what's the consequence? I'll look at the dashboard. Have you looked at the dashboard?
No.
I'll find the link.
The deadline was the 16th.
Yeah, so that
I
was
just wanted to look it up.
Yeah, because I know that I had received that email from you about that, and that when I forwarded the commitment for the abatement to use the funds, I had sent it to Sean. I also said there's a deadline at the end of this week, so it was last week, to have what's happening with this money. So, and the fear of losing it.
I mean, just to say that I, totally agree with you about, the relevance of getting community input. And also just to say that, on the other hand, given the deadline, there may be things that are obvious first steps that could be implemented or should be implemented to secure the funding while you put together the process to get community input.
I think the first place that we could secure it is within the school department.
Yeah.
Because part of it is they talk about mental health issues that impact students that would lead them to substance use.
Yeah.
And there is a captive audience, there are needs within the school department, and that we could initially start some funding there and get some funding going there. So, but again, it requires bringing the entities in town together to say this is what we need.
Yeah.
Police and fire is another one, and but also people in the community that have been impacted. People have lost their family members because of addiction, because of overdoses. So, I just think there's a better way to handle this, and I want to take a leadership role on trying to figure out what that is.
Yeah.
So I appreciate the suggestion of writing a letter. I can talk with Olive about writing a brief letter to the select board about what we think we can do and to meet these requirements with this attached to it so they can look at it. And certainly looking at the dashboard at the Attorney General's to see, what else is what else is
Get more
happening.
guidance from them about the, performance requirements for the town.
Right, and that's, that was one of the big things is that, it says municipal reporting. And it talks about receive annual abatement distributions of $35,000 or more. And that the expectation is that they have to provide reporting, regular reporting, and it talks about the reporting in here. So anyway, I don't want to lose this funding,
Yeah.
for the town if there's something we can do and to push this along.
I don't think
So-
I don't really think losing the funding is a real threat, but I mean, because I think there'd be a lot of pressure put on if it was just, well, you're late for the report, so you don't get any money
So-
anymore.
So
But
when,
I do also think so, we should be aggressive in getting it on the right people's agenda to do whatever the next logical step is.
So let me suggest first that, why don't we, I'll make a motion that we designate Donna Emerald and Olive Wachowski as the lead reps from the Board of Health for addressing this opioid abatement program, and that we, support or encourage the select board to, engage with the Board of Health to assist in developing a outreach program and recommended ways to utilize the funding to best support the needs of the community.
Second.
All in favor?
Aye.
Aye, that's unanimous. And then, I think you and Olive can figure out what's the best way to communicate with the select board, but, I think we're endorsing and appreciating that you're wanting to take an active role and are willing to put the time and energy and effort into, and know the context, know the people who are affected, or at least some, and the professionals in the field, and have a lot of expertise to bring to the table, which is invaluable, and the town should take advantage of it.
Mhm. All right, so that I will work on composing a letter with Olive and including the abatement terms and how we would like to help facilitate management or facilitate the requirements in the abatement.
Meeting the requirements.
Yeah.
And, you would like to give a presentation to the select board about it as well, and so, that way we can get information out there to the
Okay.
public about it.
Okay, will do.
Okay. And then just, maybe run it by Matt and
Yeah,
CC
I will.
us
I
and
will.
all that.
Before I send anything, I would have it checked by the board for approval. So
Okay. Great. Thank you very much for taking a leadership role in that. That hopefully will lead to more work for you.
well, but it's
in a field that you're passionate about and that is really
Right.
helpful to the town.
yeah, and I think that it's also a very it's a passionate area of concern and focus for Olive as well, who has a lot of expertise in this area. So yeah.
Okay, great. Thank you. Anything else, Donna? Just is there
I can't
another
think.
cleanup coming up? Date?
There's not going to be one in the fall.
Okay. Thank you.
I think our leader is getting. I don't know that we had a big turnout for last fall,
Okay.
but he was not wanting to do one this fall. So, but we'll have one in the spring.
All righty. Thank you.
Just that, so I reached out to, this is on the well regs, reached out to my former colleagues at DEP, and, on the question of should we pause in, kind of revamping our water well regs, town's water well regs, and, or just proceed, and the message I got back from the chief of the Public Water Supply Division at was that we should proceed. That it's kind of new money. They don't really know what they're going to do with it, and so we should move ahead to protect our private wells. So And then, kind of last week, Matt had given me a draft of where he was, and I took the draft and kind of worked it over with a bunch of comments and additions, and I just sent that back to him, to look at, kind of focused on the permitting process.
Right, that's what we talked about.
But, which has, there are just a lot of, the basic framework is there. I think there is just a lot of choices that, that need to be made along the way. And basically, I have like a half a dozen other town regulations and the DEP guidance, and I've been kind of cherry picking and making some preliminary choices of, what to do, and then, saying in annotations, to Matt, well, here's one way to go, we could go this way, or this is what I think about this, but other people have done that, and so that we can, at least Matt and I can maybe get a consensus or bring back to the board if that was, what we wanted, the process to do, or, we could go out for some informal feedback among well drillers, for example, who work in other communities. Because sometimes I look at what they say and I say, how are they really making that, how does that really work? So anyway, yeah, so.
All right, so it sounds like you're,
Yeah,
excuse me, making progress. We're focused on, we talked about some of the key things we wanted to at least get
Yeah.
going now, which was the
Yeah,
permitting process,
Right.
essentially,
yeah,
and maybe some other areas.
right.
It sounds like it's premature to try and schedule another working meeting, maybe at our next meeting.
Yeah,
we'll
yeah, I
schedule
mean, I
something.
think, sometime, in even the latter part of September, is probably really realistic if we're really getting down to, a discussion draft, or we might come back and say, here are 3 things that we would like to get feedback on, should it be 500 feet or 200 feet, kind of thing.
Okay,
Or,
sounds good. Well, thank you
should we
for,
do water quantity or not bother to do water quantity, or how do, that kind of thing, some big picture things. Yeah,
okay, well, thank you for your,
yeah,
diligence on working through that. Anything else?
that's it.
Okay. Just a couple quick things from me. I just submitted the shorelines column
I was gonna
this
ask you about that.
morning.
I was gonna ask you.
Yeah, about the transfer station updates with the move to Lot 3 for the bike recycling and the Scouts program moving down there as well. So just to alert people, because there's this period of adjustment that people will have, and just reminding them about the various, recycling stuff. So that's taken care of for this month. I think I didn't mention the last time, we had talked once before about the total nitrogen testing policy, about, after the 2 years. Matt and I, and actually Gabby, sat in with folks from the Barnstable County Septic Database Management Reporting System to get some feedback from them and kind of guidance, and clarified a few things, which was helpful, about when DEP and stricter requirements prevail versus ours and so on, and sort of how to track it, and that they thought it was reasonable, if we have something along the lines, the first 2 years of testing, the results on average are below 19 and could reduce it, and just by notifying the homeowner, we can send a copy of that letter to Barnstable, and they could update their records easily enough that way. We talked a little bit about a few other things. They're starting their pilot of the management entity to take care of O&M, all of that stuff for home, not take care of it for, but just help manage that process for homeowners, because it's sort of a bit of a thorny thicket these days. So that was really helpful. I haven't had a chance to put pen to paper on drafting that, but for either, if it's simple enough, we could address it at a regular meeting, sometime in the future, maybe by the 9th I could get something together. So that is still on the horizon. I have not gone back to look at the tight tank regs. I think we had a good discussion at the meeting. So I'll have to go back and tweak. I know there were a couple of areas that we were gonna,
Right, I made some
Clarify.
comments to Matt about it.
yeah, so we'll get moving on that, but I have not, I don't have an update on that, so. And that whole burial I hope to have, as I said, this little hiccup will get clarified, hopefully from Jonathan Hopel, and be able to finalize that. I did notify the person who's interested in getting that established, that we're not quite there yet, but he was okay. He's just trying to plan ahead, so.
Good.
Yeah. Okay, that's all that I've got. We don't have any.
And I just wanted to say, I know that I agreed to follow up with the composting
Yeah.
at the transfer station, so I will also begin to
Work on
work on that. I know that we're doing several things down at the transfer station, so
So the
it may
whole-
not happen, this year,
Yeah.
but it's certainly something that we'll continue to look at and come up with a plan.
Okay, great, thank you. Do we have any topics for the next regular meeting that we wanna put on, other than our usual updates? Our next meeting will be September 9th. We will not be meeting on Labor Day. Not that anybody was expecting to meet on Labor Day. So we'll just postpone that meeting a week. Otherwise, I think if there's hearing no other business.
So I move that we adjourn this meeting at 5:37 PM.
Second.
All in favor?
Aye.
That's unanimous. Thank you very much, everyone.